once every month for some helpful conversation about health and recreation. We got plenty of ways to brighten your day. It's not too much to listen up to our monthly healthy subjects. Even if you're on a budget, we can help you make sure that doesn't get in your way. 'Cause I'm sure we can all agree we could use a little help staying healthy and raising awareness in communities to make a better life for you and me. So tune in once every month and just hear what we have to say. Everything is gonna be okay with the Community Health Corner in your day.
Welcome to our March Community Health Corner. I'm Shelby.
And I'm Ursula. Today we are bringing you even more information that is going to help all of us live healthier lives.
To start, Ursula is going to discuss the benefits of building flexibility, and she's going to share 6 stretches that help you do so.
Shelby covers our cooking segment, presenting the most necessary knife skills to develop for cooking.
Then, Cozell is going to share the 3 factors you should consider to assess your sleep, as well as some tips to help you improve your sleep if you find that you need to do so.
March is Colorectal Cancer Awareness Month, so we have asked Dr. Bob to explain the benefits of getting your colorectal cancer screenings, as well as how often you should complete it.
We hope you enjoyed the show.
Flexibility exercises are an important part of your physical activity program because building flexibility leads to many benefits. One of the largest benefits of building your flexibility is more freedom of movement for your physical activities and for everyday activities such as getting dressed and reaching objects on a shelf. If you find that you have tense or sore muscles, stretching might just be the solution. This is because the building flexibility can provide relief to those tough muscles. Our first healthy habit for this month is to take a midday stretch each day. This will help your muscles stay relaxed and can give you a break in the middle of your tasks. There are 2 types of stretching I'm going to cover, and 3 exercises for each type. Any of these exercises are great options for your midday stretch. The first type is called a static stretch. This form of stretching is probably what you think of first when stretching comes to mind. To complete static stretches, you want to slowly stretch into the desired position as far as you can without pain and hold for 10 to 30 seconds. Relax, breathe, and then repeat 3 to 5 times. Remember to never bounce into a stretch. Make slow, steady movements instead of jerking into position, which can cause muscles to tighten, possibly causing injury. Also, avoid locking your joints. Straighten your arms and legs when you stretch them, but don't hold them tightly in a straight position. Your joint should always be slightly bent while stretching. The following 3 examples are great static stretches. The first stretch is a shoulder and upper arm stretch. Stand with feet shoulder width apart. Hold one end of a towel in your right hand. Raise and bend your right arm to drape the towel down your back. Keep your right arm in this position and continue holding on to the towel. Reach behind your lower back and grasp the towel with your left hand. To stretch your right shoulder, pull the towel down with your left hand. Stop when you feel a stretch or slight discomfort in your right shoulder. Reverse positions and repeat. Our second static stretch targets the chest. You can do this stretch while standing or sitting in a sturdy armless chair. Keep your feet flat on the floor, shoulder width apart. Hold arms to your sides at shoulder height with palms facing forward. Slowly move your arms back while squeezing your shoulder blades together. Stop when you feel a stretch or slight discomfort. Hold the position for 10 to 30 seconds and repeat. Our last static stretch targets the ankles. Sit securely toward the edge of a sturdy armless chair. Stretch your legs out in front of you. With your heels on the floor, bend your ankles to point toes towards you. Hold the position for 10 to 30 seconds. Bend ankles to point toes away from you and hold for 10 to 30 seconds and repeat. Now that we have covered static stretching, the second type of stretching is dynamic stretching. Dynamic stretching is what you want to do before a workout because those are the stretches that reduce your risk of injury. To do a dynamic stretching routine, look to the movements you're preparing for in whatever exercise or sport you're performing. For example, runners may do hip circles, lunges, and leg pendulums. Swimmers may do shoulder rolls and arm circles. Let's take a look at some dynamic stretches. Hip circles. Stand on one leg using a countertop for support and gently swing the opposite leg in circles out to the side. Do 20 circles in each direction and then switch legs. Progressively increase the size of the circles as you become more flexible. Arm swings. Stand with arms outreached forward, parallel to the floor with palms facing down. As you step forward, swing your arms in unison to the right so your left arm is in front of your chest and fingers point to the right. Keep torso and head facing forward. Move only at the shoulders. Swing arms in the opposite position and direction as you step again. High stepping. Stand with your feet parallel and shoulder width apart. Step forward with the left leg and raise the right knee high towards your chest. Use a wall for balance if needed. Use both hands or one if using the other for balance to pull the knee up farther. Pause and lower right leg, then repeat on the other side. Continue high stepping 5 times on each leg as you walk forward. Now we have covered both static and dynamic stretching. Remember, talk with your doctor if you are unsure about a particular exercise. We hope you have enjoyed this segment. Now let's head over to Shelby.
It's Shelby here. You can see my hands because today we are talking all about knife skills. So before we get into using the knife, you need to prepare your cutting board. Begin by placing a damp kitchen towel under your cutting board. You want to get the towel wet and then wring out as much water as possible. You're just going to lay it under there to create some traction. That way this cutting board isn't sliding around while we're working. So, before digging into the various knife techniques we're going to cover, it's important to first learn how to hold your tool correctly. You want to guarantee that you're going to be making precise cuts while you keep your fingers intact. So, the first knife that we're going to be using is a chef's knife. When you're gripping a chef's knife, you want to wrap your hand around the handle of the knife while pinching the top of the blade with your thumb and your index finger, where it's meeting this handle here. Although your instinct might be to keep all of your fingers on the handle like so, pinching the blade with your fingers is going to give you more control while it is in use. So this is how you will hold the knife. Notice the thumb and the index finger are pinching the handle. So, when it comes to holding the food that you're going to be cutting, you want to use spider fingers, and those are going to look something like this, to where your fingers here are gripping, and these knuckles can be a guide. So, I'm going to demonstrate without anything, that way you can see what I'm meaning. It will be like this, and your knuckles are going to guide. Using the chef's knife, we're going to dice an onion. Before peeling your onion, you want to cut it in half. Like so. Now you want to peel your onion. You want to lay the half flat side down on the cutting board, creating a flat surface. You want to create a flat surface because you don't want your food to be rolling around on the cutting board. So, you're going to create horizontal cuts in your onion. Like so. Don't go all the way to your knob because then you'll cut through it. We'll do 3. Now, we're going to make several vertical cuts in the onion, like so. And last but not least, we'll just go ahead and take that end off. We're going to go straight downward into the onion to create our diced pieces. And there you have it. We have a diced onion. How to dice an onion, we're going to look at how to mince garlic. There are basic steps for how to peel and cut garlic into a mince without a garlic press. First, you want to loosen the garlic cloves by removing any of the papery outer skin on the bulb. You can press down on the bulb to loosen the garlic cloves, like so. Now that my cloves are mostly loosened, I'm going to cut the root end of each off. So you can see here, this is the root end down here. Root end down here. Notice my spider fingers. Keep your spider fingers. Now that my root ends are removed, we are going to peel the individual cloves. To do this, you want to place the clove on the cutting board, and by using the side of the knife blade, press down firmly on the clove until you feel the skin crack. Then you should be able to slide the clove right out. Like so. Now that my root ends are removed, we are going to peel the individual cloves. To do this, you want to place the clove on the cutting board, and by using the side of the knife blade, press down firmly on the clove until you feel the skin crack. Then you should be able to slide the clove right out. Like so. We'll do that again just to show you what I mean. Place the clove, push down until you feel the crack. And, oop, there we go. That's two. We'll do one more for good measure. Hear that crack? And there you go. So, now that we know how to get out the individual cloves, you want to slice the clove lengthwise from top to bottom, and then slice it crosswise if you're going for a mince. So, we're going to go this way, chop, use your spider fingers, that's going to guide the knife. And then we're going to go the opposite direction horizontally. Oop, picked up another clove there. And I'll make a note here, when you're cutting, you want to not remove the tip of your knife. So if you'll notice while I'm mincing here, the tip of this knife is staying on this board. This is not coming up off. A lot of people, their instinct is to go like this with the knife. That's just not correct, and it's just not as safe. You want to keep this tip here and slide, kind of like so. You can hear that slicing motion. Now that we have sliced the clove lengthwise from top to bottom and crosswise, you want to run the knife repeatedly over the garlic cloves to mince it into a smoother paste. You want to turn the knife on its side and scrape back and forth over the garlic if you're going for more of a paste. So, to continue the mince, just simply keep chopping like so. Like I said, that tip of that knife needs to stay down for safer cutting tactics. I like to sometimes put the tip of my fingers here when I'm dealing with garlic in particular, because the pieces are so fine, there's not much guiding you can do with your knuckles. Or you could even hold it here if your cutting board isn't secured as well. And each time it gets more and more fine. So do this mincing pattern until you are content with your mince. The last skill we are going to cover using a chef's knife is how to cut a bell pepper. So we're going to start by, first I'm going to show you. You need to see there's these little divots here. So this is a side, this is a side, this is a side. You want to slice those off. So we're going to start with this side here. You can see my divot and my divot. Go straight down. We've got one. We've got two. And we've got three. Three might be a little more flimsy. If you notice, you get some little inside stuck, just get that out with your knife. Be very careful. The ideal method, the seeds are all going to stay in the middle there, but some bell peppers are shaped a little wonky, so you might just get some seeds that come flying at you, which is normal. Just be sure to grab those up off your cutting board. Now we have 3 nice sides of the bell pepper. If we want to slice, we're going to do this method here. Let me show you. Take your spider fingers and make small slices along the bell pepper. Pull that over there. Keep going. Now, especially as you get towards this end here, your knuckles can be used as a guide for your knife. And no injuries. Now, this is nicely sliced bell pepper. You can see some seeds might come out as you do this. That's perfectly fine. Just wipe them away. Now, that is how you slice up a bell pepper. To dice the bell pepper, you're going to take the pieces you just sliced up, like so, and line them up, all of them going in the same direction. Ideally, you want them going horizontally on your cutting board, so that way, if you want your dice, what you do, take your fingers around the side, make your spider fingers, and now we cut some more. Just keep going until you have reached the end there. Now this is a large dice. If you want it to get smaller, you just give it another pass. Chop, chop. And there you have it. We've now shown how to slice and to dice a bell pepper. Now, moving on from the chef's knife we were using, we're going to be using a serrated knife. A serrated knife is a tooth-like, jagged-edged knife. It's used for cutting foods with a firm exterior and a soft, delicate interior. A perfect use for this knife is for cutting bread. So, you want to place your loaf on a large wooden cutting board. The board should be a little longer than the bread itself. This way, you have enough room for the slices that you cut to fall and have room. So you want to position the loaf towards one end of the board, and you'll start by cutting the side that has the most board space available. To cut bread, you're going to want to place your hand over the crust and gently grip by the sides. You don't want to be pushing so hard that you are bending the bread. That's going to crush it, make it not as good. You want to hold it just delicately, that way you're not pushing down on it. So, when you cut the bread, you're going to want to go at it at a slight angle, like so. You're going to want to slice downward with the knife facing outward, like so. You're going to angle it slightly and gently saw into the bread. Saw downwards with your knife until you have your slice. And there you have it. The final knife we will be using is a paring knife. This knife is narrow and short, used for making small, detailed cuts. With the paring knife in your dominant hand, you want to place the blade at the top of whatever you are cutting. Today, I am going to be using an apple. We're going to peel the skin off of this apple. You want to use your knife and slowly press into what you are cutting. In my case, this is an apple, and as you can see, I just made a small little slice that takes away a bit of the skin. You want to brace the hand again with the knife against the apple, in this case an apple, and you want to place your thumb at the bottom, giving you more control over your cut, like so. Using light pressure, you're pulling the knife into the apple just enough to slip underneath that peel. And there you have it. I have fully peeled this apple using my paring knife.
the pace of modern life barely gives you time to stop and rest. It can make getting a good night's sleep on a regular basis seem like a dream. But sleep is as important for good health as diet and exercise. Good sleep improves your brain performance, moods, and health. Not getting enough quality sleep regularly raises the risk of many diseases and disorders. These range from heart disease and stroke to obesity and dementia. Having a healthy sleep schedule encompasses 3 factors. The first factor is how much sleep you get. One of the largest misconceptions surrounding sleep is that adults need less sleep as they get older. This is not true. Older adults need the same amount of sleep as younger adults. Generally, adults should aim to get around 8 hours of sleep every night. Check our show notes for a chart recommended hours by age. One sleep myth is that you can catch up on your days off. Researchers are finding that this largely isn't the case. If you have a week's worth of getting too little sleep, the weekend alone is not enough to catch up. Another factor to consider is the quality of sleep that you are getting. The goal is to get uninterrupted and refreshing sleep. You might be getting enough hours, but that does not necessarily mean that you're getting the most restful type of sleep. Poor sleep quality is characterized by a few potential factors. If it takes you longer than 30 minutes to fall asleep, if you wake up during the night more than once, or if it takes you longer than 20 minutes to drift back asleep after waking up. Your sleep quality is considered poor, and you will probably feel tired the next day. The last factor to having a healthy relationship with sleep is having a consistent sleep schedule. You want to try to sleep during the same hours of the day each day for you feel the best. Sleep repairs your body. While you sleep, your brain is working. Sleep is necessary for your brain to be ready to learn, remember, and to create while you are awake. To get better sleep, consider these tips. Stick to a sleep schedule. Go to bed and wake up at the same time every day, even on the weekends. Don't take naps in the evening, and keep naps that you do take short, and get some time outside each day. Our second healthy habit for the month is to get some fresh air every day. So why not kill 2 birds with 1 stone and improve your sleep while getting a nice break in your day?
Colorectal cancer is the second leading cause of cancer death in the United States. But it doesn't have to be this way. Colorectal cancer is one of the most preventable cancers and is highly treatable when detected early through screening. Colorectal cancer usually begins with an abnormal tissue growth called a polyp, and some of these polyps can become cancerous tumors over time. Unfortunately, this often happens without noticeable warning signs or symptoms. That's why screening is so important, even if you feel healthy. Screenings can prevent colorectal cancer through removal of precancerous polyps and can also detect cancer at an early stage, when treatment is usually more successful. Most people should begin getting screened for colorectal cancer at age 45 and should continue until age 75. People at a higher risk, including those with symptoms, a family history of colorectal cancer, and certain inherited genetic syndromes, may need to get checked earlier. Talk to your doctor about what's right for you. There are several safe and effective ways to get screened. Stool-based tests are generally completed yearly. They check for microscopic traces of blood or abnormal DNA in a patient-provided stool sample. If this test comes back positive, a colonoscopy is needed to rule out cancer. Visual exams like a colonoscopy look at the inside of the colon and rectum for any abnormal area that might be polyps or cancer. If abnormal growths are discovered, they can be removed during the test. Colorectal cancer screening for those eligible is available with no cost sharing under all insurance plans, and free screenings are available throughout the state for those without health insurance. If you need help finding a provider, please contact us so that we can help.
Thanks for watching our March Community Health Corner.
Ursula explained why building flexibility is important, and she showed us 6 great exercises for you to do while you complete our first healthy habit for the month, to take a midday stretch.
Shelby demonstrated proper knife skills that every person who cooks should learn, and she shared our second healthy habit for this month, which was to make a new healthy recipe.
Then, Cozell clued us in as to what it means to get good sleep, as well as some tips to help you improve your sleep if you find you're needing to do so. This is where we unveiled our third and final healthy habit for the month, which was to get some fresh air every day.
March is Colorectal Cancer Awareness Month, so Dr. Bob covered what you need to know about colorectal cancer screenings. Remember, living a healthy life doesn't have to feel daunting. Implementing small, simple changes in your behavior and consistently repeating these changes gets you closer to a healthier you, one step at a time.
That's a wrap. See you in April, when we will bring you even more information that will help all of us live healthier lives.
Every